Arrive alive, drive sober.
Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with a COVID-19 update for Simcoe Muskoka. So today we are up to a total of 16,350 cases, up 639 over the past week. We've actually had a slight reduction over the past week by 7%. And this is the first time that we've had any kind of a reduction over a 7-week period. So over the week of December the 5th to the 11th, we had 564 cases, down from 588 the week before. I think what I would reflect is we don't know exactly why that would be. It's certainly welcomed. Perhaps it's a result of extra diligence on the part of the community and on the part of businesses, perhaps in response to my letter at the beginning of December, positioning the importance of that. So I do want to commend that. But as I am about to report, I have very serious concerns about what will come in the days and weeks that follow, which I will get into later in the course of my presentation today. We've had a total of 282 people pass away through the pandemic, including 2 over the past week. And I would like to express my condolences to the family members for your loss. So they consist of a man in 80 plus in Simcoe County, unvaccinated, and a woman 80 plus Simcoe County as a part of an institutional outbreak who had been fully immunized. We currently have 28 Simcoe Muskoka residents hospitalized with COVID-19, and this is down from 30. And if I could ask people to please mute your line and put yourself off view. There are some people I can see on view, so if you could do that, that would be great. Thank you very much. So as I was saying, 29 individuals hospitalized from Simcoe Muskoka, down from 30 last week, which again is welcome news, and 5 in the intensive care unit unchanged over the past week. Their ages range from in their teen years to 90s, and 32% of them are under the age of 62. 26 are from Simcoe County and 2 from the District of Muskoka. 7 were acquired in the community with unknown source. 10 close contacts of a known case. 2 institutional outbreaks. 6 under investigation. 2 part of congregate setting outbreaks, and 1 part of an educational setting outbreak. 65% of them were unimmunized, 9% fully immunized, and 3 partially immunized. And over the last 24 hours, we've had 106 new cases reported, with 102 of them being sporadic and 2 of them as part of a school outbreak. 59 women, 47 are female. Ages range from under 10 to in their 80s. And 20% of them are between the ages of 0 and 11. With the greatest number being young adults 18 to 34 years of age. 80 are from Simcoe County, 26 from the District of Muskoka. With regards to acquisition, 91 are under investigation, 8 are close contacts of cases, 2 are community acquired, 2 in educational setting outbreaks, 1 in institutional outbreak, 1 travel related, and 1 congregate setting outbreak, all self-isolating at home. 65 unvaccinated, 2 partially vaccinated, 39 fully vaccinated. With regards to geographic location of cases, the majority, largest numbers are in Barrie, Bradford, West Gwillimbury, Aurelia, Innisfil, and Springwater Township. And Georgian Bay Township has the highest incidence of over 600 cases per 100,000 population per week. Barrie, Innisfil, Midland, Aurelia, Ormodonte, Severn, and Springwater all have had weekly incidents above 100 cases per 100,000 population per week. So in Simcoe, Muskoka right now, our incidence is 93 cases per 100,000 population per week, down from 97 a week ago. The provincial rate has increased quite substantially while ours went down. So they went up 36%, going up to 61 cases per 100,000 population from 44 last week. And this is the 8th week in a row in which we have had a rate above the provincial rate. 23% of our cases during the week of December the 5th were children under 12 years of age. The majority of these were school age between 4 and 11. Okay. Currently, we have 37 outbreaks, up from 32. And they consist of 13 new outbreaks over the past week. 9 of these from elementary schools, 1 a child care center in Simcoe County, 2 congregate settings, both in Simcoe County, and 1 institutional setting, a retirement lodge in Simcoe County. And we have 24 ongoing outbreaks in secondary schools, 3 in secondary schools, 2 in private schools, 14 in elementary schools, 3 in congregate settings, and 2 in childcare centers. And we have 9 outbreaks that were declared over the past week, 6 in elementary schools, 1 secondary school, and 2 institutions, 1 being a retirement home, the Waterford retirement home in Barrie, and the other Soldiers Memorial Hospital in Aurelia. We are approaching our 1 millionth COVID vaccine dose administration. So in total, we have 996,119 doses that have been administered, including 14,824 doses for those under 12 years of age. And we remain at 88% dose first coverage for those 12 and above, and 85% for those with second dose, and 11% of our population, 12 and above, has received a third dose of vaccination. Okay. So 38% of our cases since December the 5th, or during the week of December the 5th, were among people who were fully vaccinated, the remainder being among those who are unvaccinated or partially vaccinated. In terms of our dashboard, we remain in red status with very high incidence of cases and elevated hospitalization rate, elevated reproduction rate at 1.1. So anything above 1 means growth in the pandemic, and a very high number of outbreak settings. In terms of laboratory testing, we're at yellow status with a high percent positivity at 4.6%, but otherwise a good turnaround time for testing results. Our health system remains in yellow status, red status for acute bed occupancy, but green status for ICU bed occupancy. And the public health system remains in red category, only reaching 59.2% of our cases within 1 day, where our target is 90%. Okay. So in terms of some key messages from the data, we do see this, stabilization for the moment with regards to our incidence of cases and hospitalizations. In reaching out to the CEOs of our hospital corporations throughout Simcoe, Muskoka, I've been informed that they are very concerned about their capacity at this time, that although the numbers of cases admitted to hospital are about half of what they were at the height of the second and the third wave, their capacity is not what it used to be, with some loss of human health resources due to the experience of the previous waves, and also because they're heavily burdened with the catch-up of care and procedures that has accumulated over the course of the pandemic. And for this reason, they would be supportive of any and all action necessary that would be warranted to curb further spread and help avoid further hospitalizations and admissions. I have cited the number of outbreaks that we have, and they are very much being driven at this time by cases occurring among people who are not vaccinated, including those who until recently have been too young to be vaccinated. And one thing that we would note is that we actually have had in a single week 18 new outbreaks, which is the highest we've ever had throughout the pandemic. Previously in April, at the height of the third wave, we had 17 new outbreaks in that week. So we're at a high point for outbreaks. And I think it's very important to note also that there are probably many other outbreaks in the community that we aren't able to declare because of our weakened capacity to be able to do so. We continue to be able to reach all cases, including with the support of the province and the provincial workforce. And certainly have identified where they're located. I'm just going to ask if all people could please check your line and make sure that it's muted. I have heard somebody who isn't. Thank you very much. There are a substantial number of locations that probably are in outbreaks that have a cluster of cases that we know of that we're unable to declare as outbreaks. We are concentrating our efforts on schools to keep them in operation and on congregate settings because of the vulnerability of the people in those settings. But otherwise, we do see a substantial number of exposures happening in gymnasiums and recreational facilities, multi-unit dwellings, food premises, places of worship, office settings, and manufacturing locations. And I think it's very important for people to realize that we're having a high degree of transmission happen and that those settings are places where transmission in all likelihood is occurring, and that people need to do all that they can to reduce their risk. As always, I strongly recommend immunization and for people to receive their third dose or booster dose as soon as they are eligible to do so, and to otherwise abide by all the other protective measures at your disposal. So this certainly includes mask use and physical distancing in indoor public spaces, but also in private spaces where you may be with people from out of your household who could possibly be transmitting. Omicron as a new variant heightens the need for all of this and heightens the need for us to reduce our level of social contact substantially at this time, despite the fact that we are very much in the holiday season and that this would be contrary to usual practice. It's really critical that people reduce their risk now. And as I said, I will be talking more extensively about Omicron in a moment. I'll do so now. One thing I would say is at this point in time, we are seeing a transition happen in the province. So I have the opportunity to attend science table meetings and to view the data that they are viewing, and they will be coming forward with a report updating projections related to Omicron in this province shortly. I've been told either today or tomorrow. It's very important that their report get out because it does cite very concerning findings. So the Omicron variant was declared by the World Health Organization late in November as a variant of concern. It has a substantial number of mutations, some of which have been previously identified as associated with reduced responsiveness to vaccine or increased infectivity, increased potential to reinfect people previously infected. And the preliminary findings from other countries as this spreads around the world, and in particular from Europe, Denmark, the UK, and now looking at our own data in Ontario, is that it is spreading. It spreads very quickly. So transmits.
Nothing set in stone yet, but anything that does come, we got Steve's laptop and anything.
Christine, I think Dr. Gardner is muted.
Hello, Tara, can you hear me?
Yes, I can hear you now. You were muted for about like 30 seconds.
Okay. Did you mute everybody's line?
I'm not sure what happened. I tried unmuting you, Chuck, and it would not unmute you.
Okay, I guess you were muting everybody's line in response to those that hadn't?
I think that's what happened.
Okay. All right, well, I will start again at the beginning of Omicron. All right, so we are very concerned. I am very concerned about Omicron as a new variant that is rapidly overtaking the province, that in short order will become dominant, if it isn't already dominant. It will replace the Delta variant and has great potential for a large wave of cases, as well as substantial potential for a large wave of hospitalizations, hospital admissions, ICU admissions, by all accounts. I have had the opportunity to attend science table meetings and see their review of the data. They will be coming out with a very important report on this topic shortly, if not today. Their intention that I last heard was tomorrow. Basically, it looks at the data that's emerging in Europe, Denmark, and the UK, as well as Ontario, our experience here. And if you go to the dashboard for the Ontario COVID Science Advisory Table, you will find that they've indicated that the doubling time for this variant is 3 days. So every 3 days, the number of cases per day doubles compared with the previous 3 days. And this is very rapid growth indeed. They also indicate, by way of comparison, that the Delta variant's doubling time is every 30 days. So very, very augmented rate of transmission, a shorter incubation period. And it is well underway to overtaking and replacing Delta as the dominant variant in this province. We will see with the science table's release projections demonstrating the likelihood of a large surge of this new variant through the holiday season and into January, and the potential large surge as well in hospital and in the ICU. So this is, of course, very worrying. One of the characteristics that's emerging in the data about this variant is a reduced responsiveness to 2 doses of vaccination, that there is now the potential for people to become cases with 2 doses. And therefore, there is the need for a 3rd dose. The emerging data is supportive that a 3rd dose has a much better response rate and protective level. And therefore, in my mind, becomes the standard for full immunization. And we shall see the province's positioning on that particular statement, I think, in the very near future. And with all of this, I think we've got a fundamentally different situation happening now. So just looking at our own situation here in Simcoe, Muskoka, when I last reported, we had 7 cases of concern that were part of a household cluster, travel related. We now, and that was of the screening test, the S gene target failure, as it's called, is a type of screen for Omicron, awaiting further laboratory confirmation with whole genome sequencing. So 7 of those a week ago. We now have 26 of those, and they vary in their location. They are not all located in a single household. They are actually located in a variety of settings. Some of them are travel related and some of them are not. So with that observation, I think it's important to note that, in fact, we are seeing community transmission of the Omicron variant in Simcoe, Muskoka, and it will quickly rise in its proportion relative to all of our cases and take over. And we've also seen experience of super spreader events with Omicron, and in particular, most noteworthy, the experience in Kingston with over 100 university students who were fully vaccinated who became cases. So very concerned about the potential for this variant. And when I look at our particular data here, I've indicated we have 26 that have that screen that's positive. So 23 of those are sporadic. One's part of a congregate setting outbreak out of jurisdiction. One is part of an educational setting outbreak in elementary school. So 13 are male and 13 are female. Their ages range from under 10 to in their 60s, 21 in Simcoe County, 4 in the District of Muskoka. 6 are travel related, 6 are close contacts of a case, 1 community acquired, 1 part of a congregate outbreak, 1 part of an educational setting outbreak, and 10 are under investigation. All of them are self-isolating. 7 of them are unimmunized, 17 of them are fully vaccinated, and 1 is partially vaccinated. One of the things that people raise about the Omicron variant is its severity, and there have been a lot of media speculation early that, in fact, it was less severe than previous variants. However, we do not have evidence that clearly supports that. And early in the arrival of a new variant, it can be difficult to know how severe it will be, particularly if it starts in young people, which certainly was the case in South Africa, where it was first identified. That's a much younger population, or among university students, which is the case in Kingston. So younger populations generally are less severely affected by COVID-19. We would need to see what the impact would be in older populations, and we would also need to give it a bit of time because early on people manifest with symptoms, and it's only a little later that severity arises and people start to be admitted to hospital. So too early to tell. But even with something, even if it were less severe on a case-by-case basis, with something this transmissible that is also affecting people who are fully, well, I should say 2-dose immunized, you can end up with a large number of cases, and that could still result in a substantial wave of admissions to hospital. So just turning my attention to some overall messaging. I've spoken quite a bit with regards to my concerns about Omicron. One of the key messages with regards to Omicron is the need to get a third dose. And so the Chief Medical Officer of Health, Dr. Kieran Moore, has put on notice all health units, pharmacies, primary care, hospitals to engage in a blitz of vaccination for those 50 and above over the next 2 weeks to provide as much vaccination, third dose as possible to that age group. We're also looking at other populations to be coming online to receive third doses. At this point, the province has indicated that January 4th, those other populations would come online 18 plus. We shall see, I think, in the very near future, whether there would be changes or more details coming with regards to that. And as a health unit, we have redirected our resources to participate in this blitz. So all available staff who have the professional capacity to immunize have been redirected from other programs in order to participate in this blitz. We plan on being able to provide an additional 30,000 people with immunization above the ones that we were already planning to do, the children, 5 to 11 years of age, they were to be provided vaccination. That will continue. But we also are setting up an additional 18 large booster clinics commencing on Saturday coming and going through the week. People can book for those clinics via the provincial booking website or phone number. Also, they can seek immunization via participating pharmacies and with any primary care practitioners that are providing this, they would be participating in this. This will have an impact on our other services, including our Health Connection phone lines. So the health professionals working on that line who can provide vaccination have been redirected to that. We've switched over other staff to participate in that line, but that will still have some impact on our capacity. And we're going to be focusing the response line with regards to questions related to COVID-19 rather than to other matters to the best of our ability. Just to get in some of the details about other locations where you can receive booster doses. Cottage Country Family Health Team in Gravenhurst, Algonquin Family Health Team in Huntsville are participating. Certainly the clinic at 23 Sperling Drive, or 15 maybe it is, or actually 23 Sperling Drive, the old police station being run by RVH continues, providing vaccine will continue with this particular campaign as well. There are others who've remained eligible to receive booster doses. Residents of long-term care facilities, retirement homes, First Nations elder lodges, and others living in congregate settings for seniors. Already indicated those 50 and above, born in 1971, healthcare workers and others who work in a healthcare setting in the environment with patient care. Certainly those that are working in long-term care facilities and retirement homes. And those who had received AstraZeneca vaccine or the Janssen vaccine for the primary series would be eligible, as well as the Indigenous population and their non-Indigenous household members who are 16 years of age and above. And this would be 168 days or more after their second dose. And then, of course, there are individuals who are immunosuppressed who are eligible to receive a third dose as well as part of an original series, 3-dose series. And we do have a definition of the immunosuppressed on our website as provided by the Ministry of Health. So another very important matter with regards to the response to Omicron and the great challenge, the threat that it poses to the community is actions to be taken to slow down transmission. So very important that we be able to immunize people with their third dose as quickly as we can. And there are outstanding questions about whether or not the time interval would change for who would be eligible. So those are questions under review right now. But it's also important that we greatly reduce our physical contact with each other out in the community. And so people as individuals need to take this to heart and choose to only go out to such settings if you must, if you have to, and to take all precautions when you do, and to greatly scale back your social contacts, including those you have in your home. And it's also important that we reduce the numbers of people in public settings, business settings. Right now, we have a situation where with proof of 2-dose vaccination, people can attend such settings to full capacity. But with Omicron, you cannot rely on 2 doses of vaccine to be protective. And it is considerably more transmissible as well. And so having full capacity in such settings now becomes very hazardous, in my opinion. And as the chair of the Council of Ontario Medical Officers of Health, I have co-signed a letter to the Minister of Health sent last night, calling upon the province to continue the efforts they're doing now, but to also put in place restrictions on the capacity of businesses and public settings to 50% in order to allow for more spacing and less contact in these settings. And to also reduce the gathering limits in social settings. And to me, reducing it down to 10 persons from the present 25 would be warranted. I do know that the medical officer of health in Kingston has actually, by order, taken it down to 5 persons in personal settings for social gatherings. As the medical officer of health for Simcoe, Muskoka, I am prepared to issue a letter of instruction requiring that reduction in capacity limits 50% in the business settings and other gathering settings, facilities in our communities, and reduction down to no more than 10 socially gathering together in order to help safeguard our community. There have been, to date, to my knowledge, 7 health units that have put in place these kinds of restrictions. They were actually in response to the surge of Delta cases that they were seeing in Northern Ontario, in the Kingston area, and in Southwestern Ontario. And I was preparing for the possibility of having to do this as well in Simcoe, Muskoka, and I had put out my open letter to the community and to businesses early in December, citing the potential for this. We actually have a bit of stabilization at the moment with our rising case count overall, but it's still very high, close to 100 cases per 100,000 population. We, as a health unit, are heavily compromised in their ability to be able to respond to the cases and outbreaks we see. Our hospital CEOs have indicated that they too are limited in their capacity to respond to further cases, given the loss of capacity that they've experienced as a result and following the third wave. And with all of that, and most notably the potential for a very large wave coming in short order because of the Omicron variant, I am prepared to proceed with this type of order. I in fact, am prepared to do so within this week, unless the province so proceeds instead. So I think it's important for the community to be aware of that. I have been maintaining communication with hospital leadership, with the heads of our upper tier and single tier municipalities, with the Board of Health, and with the Barrie Chamber of Commerce. Last Friday, I participated in a town hall presentation to the membership of all of the Chamber of Commerce so that they'd be well aware of the potential for this. So it's very important that people be aware of what's coming and to do all that you can personally to reduce your risk at this time, a really critical time right now. So, I shall now take some questions that have been submitted. So there was a question from a reporter indicating that that person believed that they had received a fraudulent call from an individual pretending to be with the health unit, asking for personal information. And so this reporter was asking whether or not the health unit was aware of an increase in the incidence of fraudulent calls from people claiming to be from the health unit. So this is actually the first instance that we're aware of. What we would say is if an individual calls from the health unit or claiming to be from the health unit or claiming to be from the provincial workforce that is assisting us in response, but they leave a callback number, that is inappropriate. If they ask for financial related information, such as credit card, or if they ask for your social insurance number, that is inappropriate. We would not do that. And so those would be some alerts. And if you do experience something of that nature, we recommend that you notify the police. Okay, so at this point, I will take questions.
Thank you so much for your update this afternoon, Dr. Gardner. We will now take some questions from the media. As always, we do ask that you kindly limit yourself to one question and one follow-up in consideration of time. Can we start with Erica Engel from Collingwood Today? Do you have a question?
Yes, thank you. Dr. Gardner, it sort of feels like things are starting over again a little bit. Maybe you could, and you say now the situation is completely different. So is this a little bit like starting over?
It's a good question. It's certainly a major setback, and it's certainly a very vulnerable time right now. And it may yet turn out to be the biggest wave that we've had. And so in that regard, it would be similar to starting over again. Sorry, I'm just noting a lot of feedback. People, please mute your line. Thank you very much. So this does feel, just want to make sure that I can still be heard. Somebody, Kara, could you confirm that?
Yes, you're sounding clear.
Okay. So this does feel, this is certainly a major setback, and it's certainly a very hazardous time for us right now. And a very vulnerable time for us. I think we need to fully realize that the danger of the situation right now, that we all collectively and individually need to do all that we can to deal with it, to really scale back your contacts, physical contacts with others, really abide by the control measures and get third dose immunization as quickly as you can. So in those regards, this is a major setback and a very dangerous situation. I think one way in which we're ahead compared with the past is the great majority of our population has had 2 doses of vaccine, and we do have the capacity to move and get people their 3rd dose. So in that regard, we're in a better situation than we would have been at the very beginning.
Okay, and further to that, the time we have to wait between 3rd doses, like I'm pretty sure I got my doses as soon as I could. And even then I still have to wait until nearly the end of January until I would qualify for a 3rd dose. So yeah. You've written to the province about capacity limits. Are you also hoping to see a reduction in that time between doses?
I actually expect that it will come. I know that the UK is among countries that actually shorten their interval to their third dose, and they've certainly made a major push to vaccinate their population. This is actively under review right now by the Ontario Immunization Advisory Table, and we expect an answer in short order on that, and also the interval to second doses for children.
Thank you.
You're welcome.
Can we go with Holly Mackenzie-Suter from the Canadian Press? Do you have a question?
Yeah, I was wondering about Dr. Gardner, why you want to wait for the province to implement the rules. Like, if we understand Omicron is spreading so quickly, like, why not do it immediately today? And I'm wondering if that's because you might have heard something from them about an announcement maybe coming.
I'm aware because of my work on the public health measures table that the province is considering the kinds of measures that I've described. So I'm hopeful that we will get an announcement in short order from the provincial government that they will be doing this. But I'm prepared to proceed with it in this week if we have to. We've had very challenging experience before when we put in place shutdown measures at the end of February. It was extremely hard experience for my staff and myself in terms of the marked opposition to what was done then. And we're already, I think, in a very challenged state as an agency with all that we have to do and the level of fatigue of our staff. If I can, I will avoid that kind of experience again, but if I have to, we will proceed.
Thanks. And as a follow-up, I'm just wondering, because I know in kind of some of the expert scientists and even in some areas of the province, we're hearing that Omicron is going to cause problems with testing capacity. Like, people just at a certain point, there won't be enough tests for all the close contacts and contact tracing efforts as well. And I'm wondering kind of where Simcoe Muskoka Health Unit is at with that right now, and what you're planning in terms of if you do have to ration those resources.
It's a very good question. And if in fact the trajectory follows the path that I've seen in preliminary work at the science table, then I think we will exceed the capacity of the system to be able to keep up with testing at our assessment centers. And there'll be individuals who have symptoms who won't be able to get tested. And even among those, there will probably be a sufficient volume of tests coming back that we won't be able to keep up with it as a health unit. And my messaging as we move into that phase will be that people need to, first and foremost, if they have symptoms, isolate. And if they can get tested, and not wait for a call from us, because it's possible we won't be able to get to them. And if they develop severe symptoms, to seek care in a hospital, and to also advise their contacts that they may indeed be a contact of a case. So when we find ourselves in that situation, people are going to be advised to take upon themselves a lot more responsibility for self-care and for isolation and for measures necessary to help reduce the spread.
Can we go with Sean Gibson from Barrie Today? Do you have a question?
Hi, yes. Sorry, thank you for taking my question. There's a lot of talk about possible restrictions starting the 20th if the province doesn't do something first, but we haven't heard anything about schools. I know that I don't think you can close schools, but there doesn't seem to be a concern here, and we've definitely got a concern in the schools. So is there going to be any kind of conversation about closing schools to limit this?
Yeah, thank you very much for that question. All the way through the pandemic, we've always positioned ourselves in the public health community to try our very best to keep schools open because of the importance of education for children and for their mental health and well-being. We're still in that position. Most schools actually cease Friday. So we will get a break with regards to most of the schools. The question that will remain would be our ability to safely open them again after the holiday season. The province is issuing testing take-home kits for students to be able to help monitor transmission and identify cases during that period of time. And as a health unit, we will be proceeding with providing take-home kits that would enable for that kind of testing to happen as they're returning, to try and successfully have them return after the holiday season.
The follow-up to that is with the mental health aspect. If this is again such a concern, and schools are clearly a part of the problem, not just the problem. Sorry about that. And schools can go online. It appears that there might be something to do with the sports and the recreational activities will be limited. That's a huge part of the mental health, but yet they always get hit as well. So why not put schools online and focus on recreational and outside activities?
So children can also become infected through their extracurricular activities in the community away from school. The schools are as carefully managed an environment as we can create. In most instances, they're done to a higher degree of fidelity for the measures required than we would be able to assure in other settings. One doesn't move simply from the risk of schools to no risk. You would then move to the risks of other settings unless they too become further restricted through provincial action or local public health action.
Thank you. And not to be that guy, if you did yours on the 20th, if you implemented your rules on the 20th, how long what are we looking at for timeline? Sorry, I'll get out of here now.
Your question is, when would it commence?
When would it commence, and how long are you looking for? A few weeks for new restrictions to take place? Like, how long would they last?
Yeah. We anticipate we would commence on Monday, and we don't know how long they would take because we have a very uncertain future with regards to the Omicron variant.
Thank you.
You're welcome.
Craig Momney from CTV, do you have a question today?
Yeah, I just want to clarify, how many of the new variant strain are in Simcoe, Muskoka again?
I had spoken to that earlier. I think it was 26 or something. Let me just find my notes. 26.
Those are 26 positive with the Omicron, or just suspected? 26
with the F gene target failure. What we don't have in our data system, but I was told verbally this morning, was 3 of them actually have the whole genome sequencing confirming that they are in fact Omicron cases.
Perfect. Thanks for the clarification.
You're welcome.
Can we go over to Mary Beth Hartle from Muskoka Region? Do you have a question?
Yeah, actually, I have wondering if, I mean, obviously we've upped the number of vaccinations, but will you be opening the mass immunization clinics?
Saturday. If you're talking about the booster clinics, they begin on Saturday.
No, I'm talking about, so I think it was back on the 3rd wave and we had the mass immunization clinics in communities. Is that something you'd be looking at bringing back to get more people with their third booster dose?
So we've lost access to the many of the venues, the arenas, et cetera, that are iced. And so we don't have those. We don't have the same staffing capacity due to a general loss of human health resource capacity in the entire system because of fatigue and burnout. And we are certainly establishing all venues that we can, whether it would be the schools starting on Saturday or other municipal venues carrying through into January. And we are looking at making available through the provincial booking system spots for those bookings. So we are building up our capacity, and certainly the province wants us to be able to get up to the same kind of volumes that were happening with the mass clinics, the vaccination campaign in the spring and summer. So at the height of that, they they had 240,000 vaccinations a day across the province. They would want us to get to that. We've already, in the past, they doubled capacity and also brought online a large number of pharmacy dose administrations as well. So we want to build up the capacity and have it very high to be able to meet the need.
And the other thing is, just as a follow-up, in the past, we also had standby lists in case people couldn't make it. Are we able to get those again?
I don't know at this point. We want to use all methods at our disposal. So that's a good question. I don't have the answer to that question at this time.
Okay, that's it for me. Thank you so much.
You're welcome.
James Bowler from Cogeco, do you have a question this afternoon?
Yeah, thank you very much. Dr. Gardner, just going back to the question about the province's role in these restrictions, obviously having a seat at the provincial table, I'm sure you're aware of conversations that are happening. And from what I'm gathering here, it sounds like you're concerned that the province may be a bit slow to put their restrictions in place with Christmas just next week. Could we be looking at a provincial lockdown right after Christmas around Boxing Day like we did last year?
I really don't know, but I do know that that would not be soon enough with this rapid accelerating pace of transmission that we're seeing and expect to continue to see.
Okay, and as a follow-up, we are seeing Quebec's numbers drastically increase. Is that a concern to you? Because generally we are about a couple of days to a week behind what Quebec has happening. And do you see, I guess, that continuing here?
So it is a concern to me, and I certainly feel for them, but I think it's an indication of what we will experience as well. With a variant that doubles every 3 days, you will see very rapid rise.
Okay, thank you.
You're welcome.
Can we go with Mark Bruneman from Barrie today? Do you have a question? Mark, we're getting a lot of feedback. Perhaps you can drop your question in the chat box. Steve, do you think we could mute Mark? Thank you so much. Mark, please drop your question in the chat box and we'll answer it. Actually, we can go over the chat box right now. We do have a question from Mo Fahim. He asks, just want to clarify how many of the region's Omicron cases are in the district of Muskoka?
4.
Thank you, Dr. Gardner.
And to be clear, these are the screening S gene target failure awaiting confirmation, but very likely to actually be Omicron cases.
Thank you. We have another question from Dawn Huddlestone from the Huntsville Doppler. She asks, are you concerned that placing more responsibility on people to make the decision to self-isolate when they have symptoms, if testing needs to indeed end up exceeding, so I think she's asking if testing does exceed capacity, will it be ineffective, and are people already fatigued by the restrictions?
I have no doubt that everybody's fatigued by the whole situation and the anxiety of this over a 2-year period, the restrictions on our lives, the repeated waves, the impacts on their livelihood and their businesses and their extracurricular activities, the impacts on their children, all of it is very, very distressing. And now to have it happen and have this kind of a setback is heartbreaking. And I'm very concerned, of course, that the inability of people to get testing, which may come very soon with a large surge of cases to exceed capacity for testing, will leave people more vulnerable to transmission because it would really depend on them to self-identify and to isolate. And they wouldn't have the kind of support and reinforcement that we can provide to help make that succeed. So it is of concern to me, but I don't have a solution otherwise to address it.
Thank you, Dr. Gardner. And Dawn thanks you as well. We also have a question from Mark Bruneman. She asks, is there concern about how organizations are asking for proof of vaccination, and is there much enforcement?
We hear anecdotal reports of people that have had an experience that would leave them concerned, where the operator of a premise doesn't exercise due diligence in carrying out that check, or anecdotal reports of people using fraudulent means of having certification. It's very, very hard to actually catch this kind of thing and enforce it. And we don't have enough resources to proactively attempt to do that. We would depend on people's goodwill on both sides and our very limited capacity to respond to complaints when they arise.
Thank you, Dr. Gardner. We'll now go over to the phone line. Are there any questions from the phone today? Okay, I'll take that as a no. Is there anyone who didn't have the opportunity to ask their question this afternoon?
I do, Kara.
Oh,
Mark.
Hi, Mark. Yep, go ahead.
Dr. Gardner, what can people do if they test positive for Omicron? What can they do if they're self-isolating at home to prevent themselves from ending up in hospital?
Well, thank you very much for that question. There are some antiviral medications that have been identified through research and are undergoing approval process right now. So they're not yet available, but when they come online, I know that the Chief Medical Officer of Health has indicated a commitment to make them readily available through some augmented means in pharmacies. So that's not there now, but hopefully will be coming soon. So people really need to self-monitor, and if they are deteriorating, any business with shortness of breath for sure to seek assessment at a hospital.
So also on rapid tests there, that's always, everybody's going to want those, and there seems to be an awful lot of shortage of them. Does the health unit control those?
We do not control those. Chambers of Commerce have been a point of contact for distribution of businesses. Schools will be receiving them to distribute going into the holidays for use during the holidays, and will continue through the province to have distribution through the schools to students for self-monitoring. Long-term care facilities, the same with regards now to visitors. And hospitals, I know, are considering the potential to have such testing upon admission to hospital. So there's a range of options, and one hears of the province also seeking to set up such testing in pharmacies. So beyond that, as I've indicated, none of that is within the direct control of local public health.
So will you push for home public tests?
I think that's a good question. We're certainly pushing right now for the provision through the schools to keep the schools open. We haven't taken a direct advocacy role as yet with regards to other applications for rapid testing.
Thank you.
You're welcome.
I am very aware of the time, Dr. Gardner, so I believe that brings us to the end of our media briefing this afternoon. I'd like to thank you so much for your update, and I'd like to thank everyone who participated with their questions this afternoon. Our next media briefing will be Wednesday, December 22nd. Thank you so much, everyone.
Goodbye, everybody.
Recording stopped.
You can be a part of the winning team that shuts out impaired driving. Whether you're out on the town or just hanging out with friends, drink responsibly. Always have a plan for a safe ride home for yourself, your family, and your friends. you'll be helping to shut out impaired driving.
Visit ArriveAlive.org to find out more. Arrive Alive. Drive sober.
Welcome to Inside Mental Health with Debbie. I am your host, Debbie Mulder. Today we have a real treat. We are at Moto Yoga Studio in Barrie, voted Consumer's Choice Best Yoga Studio and Barrie's favorite yoga studio 2021. So we are here today and you're in for a really, really great experience. So when you think about yoga, you think about hot yoga, how does those things really correlate with mental health? We're going to be here, we're going to talk with the owner, we're going to talk with some students as well who are doing the hot yoga, and they're going to talk about their experiences and why hot yoga is fantastic and really good for your mental health. So sit back, relax for the first part, and then you're going to be able to join in on the second half. So get ready, and here we go. Hosanna, thank you so much for meeting with me. I'm so excited to talk with you and talk to you about the studio.